Hi everybody, it's Dr. Prabakar and welcome to another episode of the TheFibroidDoc. So January is Cervical Cancer Awareness Month, and so I'd like to share with you a few things that I think are important for women to know about cervical cancer. There's a lot of information about it and a lot of misinformation. So I wanted to share with you three little topics on cervical cancer. The first is what a pap smear is or a pap test. And then how often should you get a pap smear or a pap test? And thirdly, what is HPV and how does that affect cervical cancer, and what role does HPV have in cervical cancer? So these are the three little topics that I'm going to cover today. There's so much more to be said on this topic. If you have any questions, please type it below and I will answer them. Okay, so as far as what is a pap test, I'm just adjusting my camera here. Okay, so a pap test is a test that's done by your physician, typically a gynecologist, but sometimes also your primary care doctor. It's a test that samples some cells around your cervix and checks to see if there are any precancerous cells or cancerous cells of the cervix. So it's done using a speculum, which is a little uncomfortable. A speculum goes into your vagina, and then from there, there's a little brush that's used to sort of just scrape a few cells from your cervix, and that's how a pap smear is done. It goes to the lab, and then they look at it under the microscope. A lot of this is automated these days. Sorry, my cat is in the background. Then you'll get a result that says, yay, your pap test is normal, or you have a certain abnormality. And it's a little beyond the scope of this live to go through all the abnormalities, but maybe I'll do another session or live on that another time. So it's so that's all it is. Okay, it is just sampling the cells from your cervix to see if you have any abnormal cells of your cervix. Now, many patients come in and say, great, I'm here for my annual exam, I'm here to get a pap test, and I would like to make sure, I just want to get a pap test so I make sure I don't have cervical cancer or ovarian cancer or uterine cancer, and I want to make sure I'm all good. So while we would love to have one test tell us about all these different cancers, that is not the case. The pap test only tells us about cervical cancer. That is all the information we're getting from a pap test. Okay, so that's really important to know. So don't reassure yourself falsely that if your pap is normal, you're, check, you're good for everything GYN related. That's not true. Okay, so now that we know what a pap test is, how often should we be getting it? Now, there's a lot of confusion about this among patients and sometimes even amongst doctors, because the guidelines keep changing every few years. Now, 10, 15 years ago, every single year you would get a pap. You'd go to the GYN, and every single year you would get a pap test. That is not the case anymore. The current guidelines state that you need a pap test every 3 years if you are under 30, and then every 5 years if you're above 30. So that may seem like really a long time to go without a pap test. Oh my gosh, am I going to be okay? Like, what if I develop cancer during that time? And I'm going to discuss this in our next point about HPV and cervical cancer and all of that. But right now, just to let you know, those are the guidelines. And we start at 21. Before, it used to be 18, or when you were first sexually active. That doesn't hold anymore. So we start at 21 and we stop at 65. Okay, so that is the window at which you're getting a pap test. And 65, we stop if you've got, normal paps the past 3 times. So of course, if you have abnormal paps, we need to keep following you. But if everything's been going well, everything's been negative, and then we stop at 65. And I'll go over again why in just a bit. If you are above 30, we add on an HPV test, or a human papilloma virus test. And that is the virus that actually causes cervical cancer. Okay, so if you're above 30, we're adding that test on in addition to your pap. If you're under 30, we're not actually testing for that virus. Okay, so these are the latest guidelines, and we're always keeping tabs on it because things are changing. But currently, if you go to your GYN, they will still be doing a speculum exam, so they'll be putting that instrument in the vagina to take a look at the cervix, make sure everything is okay, but they're not actually doing the little scrapey thing that checks for a PAP. Now, some patients say, well, great, like, okay, it's every 3 years, then I'm just not going to go to my GYN. This is my cat. I'm not going to go to my GYN every year. Now, I don't quite agree with this. I think you should be seeing your gynecologist every year. You do need a breast exam. You need a speculum exam. There's so many other abnormalities that your GYN can pick up. So you should really be seeing them yearly. But the actual test, the PAP test, is done, in those intervals that I just discussed. Okay, so now that we know what a PAP test is and how often we should be doing it, let's talk about HPV and cervical cancer and all of the things associated with that. Okay, so if anyone has any questions, feel free to ask me. Otherwise, hello everyone, thank you for joining. So HPV is human papilloma virus. Okay, it is the most common STD in the US. Now, in high school, when they were teaching us sex ed, I don't remember anyone ever talking about HPV. They talked a lot about HIV and hepatitis and gonorrhea and chlamydia. These things were drilled into our head, but no one really talked about HPV. And that is the virus that actually causes cervical cancer. So it's kind of a big deal. And studies have shown that 60%, almost 60% of US women have HPV. So a lot of people have it. It is very common. I know when I tell a patient they have HPV, they're freaking out, they're embarrassed, they're nervous. Oh my gosh, am I going to get cervical cancer? And I'll go through, how this all plays in. But HPV is a virus that causes cervical cancer. If you don't have HPV, you're not suddenly going to get cervical cancer. Okay. Now, this is a very important distinction. We all hear of patients or family members doing great, and they go to get the mammogram, and suddenly they have breast cancer, or everything is going well. Suddenly, somebody finds out they have colon cancer. Right? Some of these things can creep up on us suddenly. Cervical cancer is not like that. You cannot be totally normal 1 year and then suddenly have cervical cancer another year. Cervical cancer takes years to develop. It takes about 8 to 10 years of having chronic HPV, changing your cervix to actually get cervical cancer. So I think I've only diagnosed one patient with cervical cancer in the last 7 or 8 years. So it is super rare in the US. If you're actually following up and seeing a doctor and getting your PAP test like you should be, it is often picked up at a very early stage, and we can intervene before it gets to that cancer stage. Okay, so that's really important to remember. So that is why the guidelines have actually been spaced out. So that's why we don't keep testing for it every year, because, like I said, you're not suddenly going to just develop it over a few months. And this is why we also test for HPV after 30, because it is a virus that is implicated in cervical cancer. Now, a lot of people say, well, I'm 25. I just want to know if I have HPV. Can you please test me? So the reason the guidelines advise against this is because when young women get HPV, they often clear it. So their immune systems are good, and they often just are able to clear the virus. HPV is a virus that once you get, doesn't quite ever leave your body, which is kind of a disconcerting thought, but you can prevent it from being active. Okay, so when I say clear, it means you can't detect it. Like you do a PAP, and if you were to check for HPV, you won't find it. So you may get HPV, but because your immune system is good, you're healthy, you're exercising, you're eating well, if you check for it, it's not there. And so that's why we don't check for it under 30. In previous years, when we used to check for HPV and patients had it, it led to all sorts of interventions that were unnecessary. Patients got very anxious. They underwent a lot of LEEP procedures, cone procedures that then affected them adversely. And so the society has come up with, the new guidelines that, okay, we're just not going to check for it under 30. And then even above 30, a lot of times you can clear it, just fine, but it's harder. HPV is one of those viruses, kind of like herpes. Like once you get it, it's there, and it can rear itself when you are immunocompromised. So oftentimes I'll see it in patients who are pregnant. They're like, well, I've never had HPV all this time. Now, why am I suddenly getting HPV? No, you probably had it, but now that you're pregnant and slightly immunocompromised, it's showing up. Similarly, patients who are diagnosed with a new type of cancer, like breast cancer, for example, they didn't have HPV for all these years, and now suddenly they have it. It's because they're immunocompromised. So that's something to remember about HPV. You can clear it from being active, but it doesn't quite ever leave. So because it and so HPV, if it's active, say you're a smoker, you're not very healthy, you're immunocompromised, it's going to start to become active and act on your cervix. And then when we do a PAP, it's going to then have your PAP is going to be abnormal because this HPV has acted on your cervix, and it's going to give you an abnormal PAP. Now, just because you have an abnormal PAP, it doesn't mean you're going to get cervical cancer or you're going to die. Nothing like that. Oftentimes, the PAP, an abnormal PAP, can just be followed. We don't even do anything about it these days, especially if it's a very low-grade abnormality. This is something really important to know. Your doctor, instead of repeating it now in 3 years or 5 years, they'll just repeat it in a year. And if you have a very high-grade abnormality, then there are procedures to take care of that. So it prevents you from getting cervical cancer. So I guess my main point with this third segment is for you to take away is that HPV is the virus that causes cervical cancer. If you don't have HPV, you're not going to get cervical cancer. The second is that HPV actually clears itself from your body or is inactive or dormant if you actually have a good lifestyle, if you are maintaining a healthy diet. Age is on your side. If you're young, you get to clear it a little bit faster. And then thirdly, even if it does cause some adverse effects on your cervix, these abnormalities are usually pretty low. Your doctor will follow them closely, and then we can definitely do some procedures to help get rid of some of these cells prior to it becoming cervical cancer. Another plug that I want to put in is for the vaccine, the HPV vaccine. Previously, ACOG had recommended from women ages 9 to 26. Now the FDA has expanded that up to age 45. So if you are in that age group, you can still get the HPV vaccine. It's a series of 3 doses. So please speak to your doctor about that. So that's a really great thing. We also have boys getting vaccinated now, which is great. And for women, we often get it from, our partners, male partners. And men, they don't get pap smears. They don't get cervical cancer. They often have no clue that they have HPV. And so they're kind of spreading HPV around. So if you are having multiple partners, you could be infected by multiple strains of HPV. One thing I say to patients is that if you are having sex with a male partner who is, or any partner actually who has HPV, you're getting not only that strain that they're passing on, but potentially every other strain of every other partner that they've ever had. So if you think about that, it's kind of gross, and it's potentially a lot of different strains. And not all of those strains are going to cause cervical cancer, but you are increasing your chance then of getting those strains that could be potentially dangerous to you. So that's what I wanted to share about cervical cancer, HPV, and the PAP test during this month of January, which is Cervical Awareness Month, Cervical Cancer Awareness Month. If anyone has questions, please post them below. I'm happy to answer them, or I will respond to those later as well. And thank you for watching. Bye everyone. Have a great Friday.